All right, so I'm going to go ahead and just get us started. It is about 3 minutes after 1, so we'll see more people kind of flow in. But just by way of information, just want to let you know this will be an interactive session. So we're going to ask you to be fully engaged. And we know the more that we put in, the more that you get out. And so we'll have opportunity to go into breakout sessions as well, so that you can try some of the amazing techniques that Francesca will be sharing with you today. Nakel, just want to introduce our facilitators and moderators that you see here in the room with the backgrounds that look like mine. We have Dr. Nakel Dixon Weatherby, who's here with us. She's one of the facilitators for the Cancer Screening Acceleration Program. We also have Jessica Roberson, who's a part of our moderator team. And we have Augustine Queener, who's here, who's also a moderator, who's going to be here to help you if you have any questions, if you have any technical challenges or difficulties. We're hoping that the technology will run smoothly for us throughout this entire session. But we also want to welcome any questions that you have during this session. Please feel free to drop those in the chat, and Nikel will be sure to pull your questions and pass those off to our speaker. So just want to say again, welcome to Motivational Interviewing Part 1. And this is Part 1 of a 2-part series. So we will share with you Part 2, the date and time, so that you can also record that, register in advance. So I want to start off by welcoming our speaker of the hour, Ms. Francesca Viola Hamilton. She is a licensed clinical social worker with nearly 2 decades of experience specializing in supporting adolescents, adults, and families through complex mental health challenges. She holds a master's degree in social work and criminal justice from SUNY Albany, and her clinical approach we have found to be groundbreaking, and she really focuses on evidence-based practices, many of which she's going to share with you today. She has received her advanced training in cognitive behavioral therapy, motivational interviewing, structural family therapy, and in addition to her providing direct client care, she's also a seasoned trainer in all of these modalities, and she equips fellow professionals with all the tools that they need to enhance their patient outcomes. So we're extremely excited to have her with us today. She's also the founder of I got that wrong, FVH. She is the founder of FVH Counseling LLC, and she provides therapeutic counseling, clinical supervision, in all clinical areas across New Jersey. I want to make sure I get them right. New Jersey, New York, Connecticut, and Pennsylvania. Correct. All right. So without further ado, I'm going to turn it over to Francesca.
Thank you so much for that, Tanya. That was amazing. Good afternoon, everybody. I'm so glad to be here, and I'm so grateful that you all attended. I wanted to start off this training by actually conducting a very short questionnaire for everyone. There's going to be a poll that comes up on your screen, and each question is multiple choice. There is no, don't feel that you have to get it right. Just to give me an idea of what you guys are already familiar with. So please take a moment to answer. I'll just take another minute. And please let us know if you're having any trouble accessing the poll.
We have
Oh,
ways to go. We have 30 people in the room minus the facilitators. We're looking good. So we're at 18 out of 25. You still have time to answer the questions. There are no right, wrong. This isn't a test that's going to be sent back to your workplace.
I promise.
Yeah. So we just want to see how the direction in which she's going to take the presentation. So thank you for those who answered the question. And we're getting there. We're at 20 of 25. Thank you. Keep going. Thank you. All right, we're at 21 of 25, 84% participation. Looking good.
Almost there.
Friends, some people just got let in, so this might be it for now.
Okay, that's totally fine. That's totally
Okay.
fine. So I think I'll just go ahead and end the poll. And I think we're good with everything. So, all right. Okay. So first question was, what is the first stage of change in motivational interviewing? And most people answered pre-contemplation, which is correct. And we'll talk more about the stages of change throughout the training. Second question was, what does the O in OARS stand for? And obviously, four O choices. But the correct choice was open-ended questions. And most of you got that right. So kudos. Which of the following is an example of an open-ended question? And the most effective open-ended question here is, what are your thoughts on completing a cancer screening? And we'll talk more about why that is the most effective open-ended question. Question 4, why is reflective listening important in patient interactions? And honestly, the most accurate here is that it demonstrates understanding and builds trust. And the last question is, how can affirmations help a patient in the change process? And the most accurate answer here would be by reinforcing their strengths and motivations. So you guys did really well. Thank you so much for participating in that. It gives me a really good idea of where you're all at in terms of your knowledge base around this topic. Okay. I can't see the presentation. Sure. I'm sorry. I'm just trying to see where that went. Okay. So I don't know what slide we're on. Sorry, guys. Short technical issue on my end.
And I think, let me try and pull that up for you.
So weird. Okay. No, that's not what I meant to do. Okay. I don't know what happened here. Oh, there we go. Okay. Okay. All right. So why don't we start by talking about the summary of this training? So the whole idea of this training is to introduce all of you to the foundational concepts of motivational interviewing. We're going to be focusing on the stages of change and the OARS framework in this initial training. OARS being open-ended questions, affirmations, reflective listening, and summaries. My hope is that all of you will be able to explore how to recognize and support your patient's readiness for change while building up your essential communication skills with them and to foster a more collaborative relationship. And obviously we have learning objectives here. First learning objective, obviously, just to define what motivational interviewing is. Second is to understand the key components of the stages of change model. The third is to demonstrate a basic understanding of the OARS framework and its components. And the fourth is to practice using OARS techniques to enhance patient engagement and motivation. And I would encourage you, if throughout the training, if you have any questions, to please drop them into the chat, and I will do what I can to answer questions as I am presenting. Okay, so what is motivational interviewing, right? So at its core, motivational interviewing is a patient-centered directive method for enhancing intrinsic motivation to change by exploring and resolving ambivalence. And when we think about how motivational interviewing was developed over years, it really did start in the medical model. It actually does not come out predominantly out of the mental health field. It was developed back in the mid 80s and over the years has been revised and reviewed. It is an evidence-based model, so there is a ton of research that supports the efficacy of motivational interviewing, particularly in medical settings, right? And when we think about what it means to have a patient-centered approach, we're looking at it through the lens of emphasizing a patient's autonomy and their right to choose goals and or interventions based on their identified needs. You know, when we're thinking about intrinsic motivation, that can be described as doing something motivated by our own passions without the incentive of a reward or fear of a negative consequence. So when we're thinking about motivational interviewing, we really want to tap into that, right? We don't necessarily want to scare patients. We also don't want them to feel as if not doing anything is also okay in this scenario. We want to capitalize on whatever their values are around their own health. And then ambivalence is really just often described as being wishy-washy, right? It's, you know, that kind of back and forth. And it's the gap between who people are and who they may want to be, or what they're doing currently and what they may want to do, right? The goal of motivational interviewing in large part is to really help get patients unstuck from these very ambivalent feelings, right? And these very uncertain decisions that they may be making. So we talk about, you know, what the goals are. We talk about what the benefits of this are, right? Improved patient outcomes, increased adherence to treatment plans, and then overall better patient and provider relationships. So the spirit of motivational interviewing. So the spirit of motivational interviewing comprises of 4 components. It's acceptance, compassion, evocation, and collaboration. And I know I said that word wrong, and I apologize. So acceptance, right? The idea of really just embodying a disposition of acceptance is by recognizing that people have the right to make their own choices, free from the judgment of others, right? And so, on the, I guess, right side of the screen for most of you, there are some questions here to think about when you are thinking about these components, right? And so what are some of the things that we may do that stifle acceptance for our patients, right? And if you think back to interactions that you've had with patients over the years, the things that you have witnessed, you could probably pinpoint either things that were said or done where we're like, wow, we really didn't consider whether or not we were fully accepting what the patient wanted in that moment. Compassion. Employing compassion is by extending as much empathetic care as you can without judgment, right? And so the question around that is, well, how do you find a balance between your self-interest, right? Because as a medical provider, you obviously have goals for your patients. I know in mental health, I do. There are things that I want to see my clients achieve, but I also have to give space to what my clients want for themselves. And there may be times that those things will come into conflict. So how do we balance that out and maintaining our sense of empathy and compassion for our patients, right? Evocation. So what are we doing here to learn about our patient's strengths, right? How are we being intentional and asking the right types of questions to help people resolve the ambivalence, the wishy-washy feelings, the challenges in making a decision? And collaboration, working in partnership with people. Really hard to do sometimes when you are facing so many other external factors that put pressure on you. But we can control some aspects of these interactions, and it's generally just how are we talking to one another? How are we contributing to conflicting feelings in patients? And now, one thing to keep in mind in motivational interviewing is that conflict is not necessarily what we are looking to avoid. We're looking to build the right type of conflict with a patient, right? We want them to feel some conflict in what they are looking to see happen for themselves and what they are currently doing. Or we want them to feel challenged by some of the information we're giving them because we want them to really start exploring what are maybe some better options for me to consider. Or, I know I don't feel comfortable doing this thing, but maybe there's something here that I need to consider. Okay. So what are some of the core strategies to, help highlight and support somebody through their ambivalence? So once again, empathy. Empathy, I think, is at the core of almost all of the work that we do collectively. And being able to express empathy with our patients is really at the core of motivational interviewing. It helps create a space in which patients feel supported, where they feel understood, where they feel heard, right? And sometimes empathy really just boils down to, if I were in their shoes, how would I be reacting to this thing? Even if it is the simplest of questions, right? So we really want them to feel as if we are truly understanding why these things may be challenging for them, right? We want to develop discrepancy. So we talked about conflict, right? So we start off really by pointing out conflicts between goals and behaviors. So if a client or a patient comes into you and says, I've been having these symptoms, I don't really know what they are, and you as a provider recommend some form of testing to them, and their immediate reaction is to be like, I can't do that, right? This is where we would want to practice developing discrepancy with them. It's like, well, you came in, you wanted to find out what was wrong with you, you're not feeling well, things are a struggle for you health-wise. This is one of the ways in which we can do that, right? So that right there is creating that conflict, that discrepancy that we're looking for, right? And it really does help the patient to identify their own goals and values. A lot of times it leads towards small steps. And it focuses on things that are feasible and that you can accomplish in the moment, right? A lot of times this would, involve doing pros and cons with clients, and then even allowing space for a patient to make their own argument for change, right? To come up with ways that they can accomplish certain things that may look different than what you're presenting to them. Rolling with resistance. This is probably the hardest component of motivational interviewing. And as somebody who has been doing this for a really long time, it's also the thing that I struggle with. It's the suppressing your natural urge to argue, right? And to push back with client presentations that are the antithesis of what you're trying to accomplish with them, right? Human beings, as just a natural part of our own development, we have a built-in pushback meter, right? Even when we don't want to, inevitably at some point we are going to say no, or I don't want to do that, or that doesn't work for me, even when it is something that we know that we need to accomplish. That is just a natural setting for us. Our job as providers is to really work on not centering that in our conversations with our patients, right? It is a momentary pushback. It is not insurmountable, and it is not necessarily the only thing that they are going to feel in that moment. So we kind of work with it, right? We incorporate it into our conversations with them around, developing that discrepancy. We're expressing empathy when we hear that pushback, because we understand that it comes from a place of need and fear sometimes. And then the last thing we do is we are supporting self-efficacy. Ultimately, the goal here is not for the patients to necessarily do things the way that we want them to do. We want them to actually take ownership of the decisions that they are making, right? Yes, it may fall in line with goals that we have for them as providers, but if they own it, they are more likely to follow through on it, right? So these are really where you become sort of like the cheerleader in the room. As soon as a patient starts moving into that space where they're talking about, well, maybe I can do this, or, what about this? You now become a cheerleader, right? You're expressing enthusiasm and optimism that these things can be accomplished. You're maybe bringing up other ways that they've been able to do this, especially if it's a patient that you've worked with for some time. And you're also validating their feelings, both positive and not so positive, because we don't want them to get stuck in a spiral of thinking, I cannot do this, right? So all of these things are really meant to highlight the ways in which we can actually help patients move through the stages of change. See you next slide. And these are the stages of change. Okay, so a lot of people may have seen this. Stages of change are really meant to illustrate what the cycle looks like for most people, right? I will say this, that you'll see that there is a gray circle there that says relapse, which is optional, right? Relapse can happen at any point throughout these stages, right? And we're going to go through each of them and give you just a basic overview, right? But it's important to note that the stages of change are not a linear process. People can move between stages fairly rapidly. You will have people come in at pre-contemplation stage and move into action right away, and then drop back into contemplation because something falls apart. It is not unusual, okay? Next slide. So the stages of change in a nutshell really explains or predicts a person's success or failure in achieving a proposed behavior change, such as developing different habits. It does attempt to answer why the change is stuck, or alternatively, why the change was not made. So we start with pre-contemplation, right? Vast majority of people start in this stage, and it's really a stage of either being unaware or unwilling to change. A lot of times it's because people do not understand their current circumstances enough to understand that change is necessary, right? So in this stage, people do not intend to take any action in the near future, and they can be unaware that their behavior is problematic. When you are dealing somebody who is coming in at this stage, you're going to be encouraging to think about the pros and cons of the changes and to feel the emotions that affect it, right? So if we're thinking about in any kind of medical setting, and we're asking a patient to take on the responsibility for some level of medical care for themselves or for maybe a family member, and they are hesitant on even contemplating what that might look like, you have somebody in the pre-contemplation stage, right? They're they're almost at the point where you can have a real concrete conversation, but there's something holding them back, right? And the strategies here is you're really just looking to build rapport. You're looking to provide some psychoeducation, and you're looking to see if they can reflect on what their health risks are. And next slide, please. So the next stage is contemplation, right? And then this stage, people are beginning to recognize that what's going on is probably either problematic or is a barrier. And they're starting to really look at the pros and cons of continuing on this place. When you're working with somebody in this stage, they are usually aware of the pros and cons, and they're about equal for them. So the ambivalence here is about changing because they're not necessarily seeing the downside to continuing as things are, but they recognize that the downside does exist, right? Your strategies here are really, again, to explore what the cost benefit for them is, to validate all of their concerns, and to encourage some small steps. And then preparation. This is the patient that is, at this point, they are ready to start taking action, right? They are thinking about what they need to do in order to accomplish this goal. They are maybe in the process of having conversations with you as a provider or with other support systems to think about how they need to move forward. And in this stage, we really want to roll with that momentum, right? So we want to encourage them to seek support, to tell people who might be able to help them move through whatever the stages of this process might look like. We want to develop an action plan with them, right? We want to talk about scheduling, about screening. We want to work on identifying barriers. I'm thinking back to when we had back in the fall, where we had just a meeting amongst providers, and people were talking about what barriers are, right? These are some of the things that would bring up into that space. I know a lot of people mentioned transportation being a barrier for people, the costs being a barrier for people. So this would be when you would start discussing those more practical things that would keep a patient from following through on their plan, right? And again, you're really just going to be encouraging them, right? We recognize that despite the best laid plans, things may not work out. That doesn't mean that we're not going to give it our best shot in getting clients to a place where they actually feel empowered to take on the ownership. And then the last one is action. This is it. This is where people are actually actively making changes. When you're working with somebody who is in the action stage, it feels like, oh, there's not much here for me to do, but it is a reflection of the previous stage of preparation, right? All of those things that we talked about in terms of overcoming barriers, making plans. The action stage is us really just reinforcing that. We're problem solving challenges that may come up that maybe we didn't think about before. And then we're just providing support. Okay. And then the last step is maintenance. So now we're looking at patients who are maintaining certain changes or coming in, being met with new challenges and are utilizing the skills that they developed before to address those new challenges, right? And this is really, again, the latter half of that cheerleader stage. We're really recognizing what they're achieving. We're making plans for things maybe to be set back, right? We're not anticipating it necessarily like full force, but we recognize that life happens. And then we're providing ongoing support for continued screenings, any follow-ups if something develops as a result, making sure that we are following as much as we can that process and ensuring that our patients are able to meet the goals and the challenges that are coming up for them. Okay, so how do we get patients through the stages of change? Well, OARS. The OARS framework was specifically designed to help facilitate conversations between providers and their patients in a way that is affirming, empowering, and actually moves patients through the stages of change, right? These conversations are meant to actually allow patients to have the freedom to express themselves, right? And to provide them with this sort of very open space where they can hear the things that they are saying and actually get some feedback around that, right? And OARS just stands for the 4 components of the framework. Number 1 is open-ended questions. Number 2 is affirmations. Number 3 is reflective listening. And number 4 is summarizing. And we're going to run through each of those and give you an idea of what that looks like. Okay, so open-ended questions, simply put, are questions that cannot be answered with a simple yes or no, right? So we're looking at the pre-test, right? One of the questions was, which one of these is an open-ended questions, right? And I noticed that a lot of people did pick the answer, which was, when was your last screening? Because that is not necessarily a simple yes or no question, right? But I also think that it's important to note that it's also not a question that comes with a single answer, right? So it's more than just yes or no. Is the question inviting detail? And that's really the goal, right? So when we look at what would be a good open-ended question, we have here, like, what are your concerns about scheduling your cancer screening? How do you feel about making a follow-up appointment? So this is accomplishing a couple of different things, right? It's getting more descriptive information. It's helping facilitate some level of dialogue between you and your patient. Requires more of a response than just yes or no, or a single item. It often will start with the words like how or what or tell me about or describe, right? We're going from very general questions to more specific questions, right? So these 2 questions are really focused on how people feel about taking this type of action. And it really does help the patient understand what we are trying to accomplish with them, right? It gives them our agenda. It's like, oh, we're going to be talking about why it is I'm not necessarily following through on this thing right now. Okay, so I know where this conversation is going. All right. So that's open-ended questions in a nutshell. Next slide, please. So next step is affirmations, right? And this is where we are using positive reinforcement and acknowledging strength and effort. And it does go hand in hand with open-ended questions, because you're going to take the information you get from those answers and use it to build up your affirmations, right? So let's say the patient answered in the affirmative and told you, yeah, they're nervous about scheduling a cancer screening, but they really want to do it because they know it's important, right? And here you have your affirmation. It's great that you're considering scheduling your screening, and it's a big step towards taking care of your health, right? So we're pulling our affirmations directly from the information that we are getting. And the thing about affirmations is that they have to be sincere, right? We're not kind of just picking out things that are, you know, unimportant or not valid to the patient. We want them to hear our sincerity when we are affirming them in whatever they are telling us. Even if the affirmation is around acknowledging valid concerns, pain, you know, feelings of being overwhelmed, that can still be an affirmation because we are affirming that in this moment they are overcoming that in order to be here. We want to support and promote self efficacy. We want to acknowledge their difficulties and validate their experience and feelings. And we want to emphasize as much as we can past experiences that demonstrate strength and success so that they don't feel mired in this feelings of discouragement, right? So some of the basic ways you can affirm a patient is to point out the positive aspects in terms of their behavior, their intention, their struggles, whatever they're thinking and feeling, and even traits and qualities that you may know about them, right? And, you know, in the mental health field, we talk about affirmation, and it's like the biggest tool that we have in our toolbox, and they're free for everyone. Okay. And then the last stage is reflective listening. And this is basically parroting back to a patient what they have said so that you can help them recognize that you are hearing them. And I usually like to use the phrase, so let me just make sure I got this clear. Let me make sure that I heard you correctly, right? I want to give them the opportunity to correct me if I am repeating something in a way based on my understanding that is not what their intention was when they told me that, right? And there's a lot of different statements, right? They're simple. You're basically repeating back what you were told. There is complex, where you are now bringing in additional information based on what they told you and sort of reframing and revising what was said in order to include some additional information, right? The complex reflections really are about adding meaning, right? So if you are using them, you're looking to maybe use it as a way of deepening your understanding of what's going on. And then the double-sided is really used in highlighting discrepancies, right? So we're using those reflections basically to illustrate their difference between what the patient is saying and what is actually going on, right? And I think the last phrase here really highlights that. Like, even though transportation is tough, you realize your health is at risk if you don't make your appointments, right? And so anything that you do in this sphere is really meant to engage the patient in responding back to you. We want them to give us feedback. We want patients to tell us if we're not hearing them correctly or if we're not understanding what their concerns on. We want to invite them to clarify things for us, right? And so when you're using all four of these components in conjunction with one another, what you are creating is a space in which clients and patients are feeling really empowered in being honest, right? And even though they may not be saying things that we want to hear, we want to encourage that because it gets us closer to where we would like them to be. And then the last part is summaries, right? Summaries are used usually at the end of the conversation, and it's just a recap, right? We are recapping what we talked about. We are recapping whatever agreements were made during that conversation, or we are recapping whatever challenges have come up that maybe we need to explore with somebody else or at another point, right? The whole point of a summary is, again, to continue to invite your patients to give you feedback on, like, yes, that's what we agreed to. Nope, I didn't agree to that. Or now that you say it like that, maybe we need to revisit that kind of conversation, right? The most important thing about summaries is that you need to at least give your patients a heads up that you're planning on summarizing, right? So there should be some indication about, this conversation is coming to an end. Either you're saying something, okay, so maybe in the interest of time, or, I'm glad that we had this conversation and here's what we're going to, do next. And going through and summarizing things, be selective, hit the highlights, right? You don't want to give a really long one, but you want to emphasize the areas where it's going to helpfully move your patient closer to that end goal, right? You can note ambivalence and attend to any statements about change in your summary. I really recommend it because it does help the client and the patient remember that, these were things that they were thinking about, and now they have something to further contemplate. Be concise and end with an invitation. And sometimes that invitation is an offer of further support. Sometimes that invitation is an offer of another conversation. Sometimes that invitation is, I would like to schedule another appointment with you. Right? Whatever the invitation is, we want, again, patients to feel like they're invited back, despite whatever pushback they may have been giving you. Okay. So I know that I gave you what I like to call the quick and dirty breakdown of motivational interviewing, stages of change, and the OARS framework. And I want to give you all an opportunity to practice this, right? But before we go into the practice, I would actually like to do another poll, because I want to see how much now you're carrying forward with you. So I think... Okay, so if you can please all answer the questions. Again, this is just to see how much you guys are taking away from this. And there's nobody's getting reported anywhere for a wrong answer, I promise. Okay, just a couple more people left to answer. Okay, I think we got mostly everybody. So I'm just going to go ahead and end the poll. Thank you so much. And we're just going to share those results. Okay, so the first question is, how can recognizing the stages of change help in patient interactions? And most of you got this right. It really is designed to just help tailor conversations to the patient's readiness, right? We're really just looking to see what we can accomplish in our conversations with them, and being able to recognize where a client is at the stages of change makes that much easier, right? Great. The second one, which is the following is an example of an affirmation, and all of you got it right. It's great that you're taking steps to manage your health, right? None of the other answers are negative in that respect, but this way of phrasing things actually helps encourage patients to move further along in that process. So kudos. All right, third question. What is the main purpose of motivational interviewing? And most of you got this answer correct: to empower patients in making their own health decisions. That's it. That is really the whole goal here. We want patients to be empowered. We do recognize that sometimes that empowerment may not look the way that we would want it to, but the more that we empower patients, the better decisions that they tend to make overall for themselves. So great. Number 4, how do summaries help in patient communication? And once again, reinforcing key points and clarifying the patient's perspective. Again, really helping to empower patients, really helping them to think more critically about the things that they've put out there, what they're willing to do, what they're not willing to do. All of that can be encapsulated in a summary. And the last question is, what strategies can be used for patients in the contemplation stage? And most of you also got this correct. Validating concerns, discussing pros and cons, and encouraging small steps. Really, 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 really critical, because we want to see clients move, and we also need to make sure that that movement is sustainable long term. So this was really great. You guys did awesome. Thank you so much. Okay, now we are going to do the favorite part of everybody in every single training ever, which is the role play breakout room exercise. I know, manage your enthusiasm, but I promise you it will not be that painful. So what I'm going to ask everybody to do is to enter, you'll all be entered into a breakout room. I am going to put the exercise in the chat box so that it's accessible for everyone. And it's a very straightforward exercise. I'm going to give you 3 scenarios. You're going to pick 2 people. One person is going to play the doctor or the provider. The other person is going to play the patient. And you're just going to practice your oars, right? You can practice asking open-ended questions, practice your affirmations, the reflective listening, and the summarization, okay? And it should only take a few minutes. I want whoever is not involved in that role play just to really think about what it's like for you to witness that. Please do not worry too much about whether or not you are doing things correctly. This is really just to practice and get a sense of how this works, okay?
Fran, before we go into the room, I'm just kind of doing a time check. We're about 7 minutes to the close. So if we could make this a 3-minute or 4-minute role play, perhaps we'll just have time for just one role play per room.
Yeah.
And then we want to bring everyone back and share with them the process in which they can obtain CME credits or CU credits for this event.
Not a problem.
Okay.
That's fine. Yep.
Yeah, just didn't want to miss time. Thank you.
No. If anybody has any specific questions or any feedback, anything that you want clarity on, I'd be happy to answer as quickly as I can. And I will say that the second half of this training will expand upon much of what we talked about in this training. So if you are able to attend, please do so. I would love the opportunity to provide you guys with some more information, but I'll hand it off to you, Tanya. Thank you.
But thank you, Fran, for that amazing training. I actually took a lot of great notes myself on that. And so I want to thank everyone who attended today. Well, really quick before we let you go, just wanted to share a couple of slides for you around the CME. So this webinar is a 1-hour CME accredited webinar. Just wanted to make sure that you understand that you will receive an email with a link to complete the post-session certification. Also wanted to share with you that there are no disclosures, that we are obligated as a CME to make sure that our presenters are not being paid or supported or encouraged by any outside organizations and any financial responsibilities. So please look for your email that will have a link. There will be a link that will lead you to the post-session survey. You are required to have attended the entire session. So we will go through to make sure that you attended the 1-hour session, and then you will have access to a portal to retrieve your certification for a 1-hour CME or CU credit. That's it. I'm going to hand it back over to Fran if you have any closing questions, remarks. Oh, and we also have Augustine to show the link for the part 2.
So I just wanted to start off by thanking everybody for attending. It was really fun. I always like doing trainings. If anyone has any questions, please feel free to drop it into the chat. Otherwise, thank you again. Thank you for your time. Thank you for your participation. And I hope to see you all again soon.
Augustine?
Yes. Not sure if you all can see my screen,
Yeah.
but we do have motivational interviewing part 2, which will take place next Wednesday, June 25th at 1 p.m. with our amazing host once again, Francesca. So hope to see you there, and we'll make sure to get you all that link so you guys can register for that as well. And then we also have another amazing event, July 9th, Workflow Excellence with Vaughn Barker as our presenter. So hope to see you at those events, and looking forward to connecting with you all once again.
Okay. Thank you, Augustine. Next Wednesday, 1 p.m. Same place, same time. Motivational interview part 2. Thank you, everyone.
Thank you.
Thank you all. Have a great day.
Thank you.